Hi, I'm Joyce Barnathan, President of the International Center for Journalists. Pleasure to be here today with Rachel Jones, one of our outstanding Knight Health Fellows who is based in Kenya. Rachel helped the Nation Group produce a groundbreaking front-page story on the sorry state of hospitals in Kenya, which ultimately led to the government to spend $5 million to improve the facilities in healthcare and hospitals around the country. So, Rachel, I just wanted to ask you, what have you done to follow up on this story? Is the money being spent on hospitals? Is healthcare improving?
Well, I think I've taken a two-pronged approach to trying to quantify just what exactly has gone on. In recent months, the approach has been to get every reporter that I work with to keep a very close watch on things like how conditions are changing for the better or for the worse in facilities in their region, in their districts. But then at the 6-month point, from the time they made that promise, I decided it would be a terrific opportunity to do a sort of follow the money approach, or to quantify what exactly has been done. And I realized that given the sort of volatile climate right now going on in the Kenyan government and in politics there, that the best way to try to build cooperation with officials around discussing this issue would be to present this to them as an opportunity to show the public how policy is developed. What we want to do is take those three elements: what a government entity would do to make this problem better, what a private entity, and then get the Kenyan officials to show us what exactly you have accomplished in a 6-month period.
Now, tell us about other projects you're working on. Tell us about these science cafes that you're helping to create in Kenya.
Well, this is part of one of the most exciting things that I'm helping to work with now. Shortly after I arrived in Kenya, I met a young woman who is a scientist. She actually is in the Communications Public Health Division of the KEMRI Wellcome Trust, based in Nairobi. And she and her friend of hers had become familiar with something called the Café Scientifique, which is an international concept, if you will, of bringing scientists and researchers to informal settings to discuss issues like malaria, HIV, child health, major sort of public health issues that the public often finds thorny and unreachable or whatever, or too technical. Bring them to a coffee house, to a bar, a restaurant, whatever, and have them talk about their work in ways that are a lot less formal, a lot more approachable, and that the public feels that they can go and ask questions that at a seminar or at a conference they would feel embarrassed, they would feel uninformed, and probably wouldn't speak at all or even show up. The most exciting aspect is that my talking the concept up to people within Nation Media Group. Originally I was trying to get them to fund the actual cafes, but then I thought, you know, using it as a training vehicle would be one thing, but why not have Nation Media Group try to broadcast the Science Cafe format? I think it's very much viewer friendly. It's very much the kind of thing where a person would maybe take the time out to sit in front of the TV for an hour and a half and not only hear from researchers, but modeling as people in the audience ask questions that they may have had. I'm hoping is that they will be broadcast on a monthly basis by this summer.
Well, that would be great. How large an audience would that involve?
It certainly would be broadcast across Kenya. NTV is broadcast throughout Kenya. If broadcasting it on a local basis in Kenya works and the feedback is strong, there could be an opportunity to have it go on a satellite, on cable, and have the Science Cafe imprint throughout the continent.
Wouldn't that be great?